Let's get on with the show. Cod liver oil. It's an extremely important anti-inflammatory antioxidant. But see, this is how cod liver oil acts. And a lot of people think, rancidity. Odor and harm or toxicity are not correlated. One of the most toxic substances we know is carbon monoxide, odorless. Our olfactory sense for quote-unquote rancid fish oil, we're extremely sensitive. We can detect rancidity in fish oil down to a part per billion. So when you smell your fish oil or cod liver oil and there's a little rancidity, it's infinitesimal. You may not like the smell, but in terms of the extent of rancidity, it's minuscule. And why? Because the fish oil protects itself from oxidation. It sacrifices itself. So you get a little teeny bit of oxygen above this bottle or this capsule. It's absolutely minuscule and irrelevant. So don't be fearful of cod liver oil or fish oils. Take them. Mercury. Okay, you can worry about that a little bit, but we have detoxification pathways, so it's always a risk-benefit analysis on these types of substances. And my rule of thumb with almost every supplement, because I can't necessarily go to the manufacturing plant or really QC what's going on, is I do a rotation program on almost everything, particularly cod liver oil. And so in cod liver oil, I generally use 5 brands, because I give one to my dogs. I use just Garden of Life, inexpensive cod liver oil for my animals. But for myself, Rosita, Carlson's, Nordic Naturals, Green Pastures. And I rotate them. I'm done with one. I pre-order another one. What do we have there?
The Garden of Life.
Garden of Life. I give that to my puppies, Andrew.
Yeah, thanks for that.
But that's Garden of Life. Jordan Rubin, we know him very well, and now Roach owns Garden of Life, so they're okay. But it's a low cost, but probably at the top notch low cost cod liver oil with the Garden of Life. But the Weston A. Price Foundation, Weston Price, almost 100 years ago now, traveled around and looked at around 14, 15. I feel for you, Andrew. 14 or 15 indigenous cultures. And he could look at the health of the individual by looking at their jaw structure, how their teeth came in, the health of their jaw. And of course, vitamin D plays a huge role in calcium deposition in bone and bone structure. And what Carlson's recommends is, what Weston Price Foundation recommends is the Rosita brand. But they also say cod liver oil is the number one superfood of all superfoods. And the other thing, so now you know about everything you need to know about cod liver oil, but the dose makes the cure, okay? So like the Framingham study, the longest ongoing study in modern history, studying health, risks, outcomes, things of that nature. So they do a study with 1 gram of cod liver oil or fish oil, and they say, it doesn't really protect against heart disease because the dose is inadequate. Why would 1 gram be the right dose for vitamin C, cod liver oil, things like that? The medicinal dose for cod liver oil is significantly higher than 1 gram. Okay, and that's what we have to know. And I run the survey, Dr. Kerner and I run the survey, and I see, yes, I take fish oil, 1 capsule a day or 2 to 4 capsules. Good. Inadequate, particularly if you have a dis-ease, brain, eye, pain, mood, autoimmunity. That's an inadequate therapeutic dose. Unless you're like me that it eats 1 or 2 servings of fish a day, sardines, Scottish salmon, Alaskan salmon, oysters. I'm constantly eating fish, so that's a big part of my dietary component. But so cod liver oil, very important. Dose is very important. Now let's get into it to sort of explain where it all lies. And Dr. Oz did an episode on cod liver oil. But she showed this kind of repulsive face to the cod liver oil. And then when she took it, she said it's not so bad. But she set cod liver oil back significantly because we have a preconceived notion. It was owned by Nestle, thank you. I thought it was Roche. But we have this preconceived notion that cod liver oil is nasty. The way you solve the nasty issue with cod liver oil is you take it right after dinner. Well, your brain is repairing itself when you sleep, mainly. The eyes you're sleeping for your brain and your eyes. Your bicep's not tired. Your bicep can go 24/7. Brain and eyes. So why do I take it on a full stomach right after dinner? Evening, I already explained. But if you take any oil, MCT oil, olive oil, any oil on an empty stomach, you really don't get a good response from your digestive system to start digesting it, and it can sit there. And then cod liver oil, you can detect that rancidity very easily. It's going to get a little oxidized in your good stomach acid. So it's not good to take it on an empty stomach. I remember during intensive training in my cycling days, I was going out with this young puppy, 10, 15 years younger than me, and I thought it was a good idea to take some cod liver oil in the morning before our 85-mile ride. And at around 50 miles, I was so miserable because I was burping up cod liver oil. Not the right thing to do. And I don't want any of you to have that bad experience either. So you take it after dinner. It's that simple. But so cod liver oil has been known for centuries to help relieve pain, prevent rickets, which is a painful bone disease from lack of calcium because of lack of vitamin D as an escort for calcium into the bone. And severe diseases, particularly including rheumatoid arthritis and tuberculosis, bacterial infectious disease of the lung. Okay, so cod liver oil is a natural antibiotic. Nobody wants to take an antibiotic, so take cod liver oil regularly, and you'll probably never have to take one. But if you have a serious brain disease, eye disease, that it's infectious, you may need antibiotics or similar type therapies. But cod liver oil is definitely part of every one of our pre-treatment programs. So you can look up cod liver oil on Drug Bank and see that, it's the oil extracted from the liver of codfish. Look, we modernized, civilized, quote-unquote, people, particularly in America, don't eat the organ meat. Plants are loaded with minerals. The minerals come from the soil. Those minerals, when an animal eats the plant, is concentrated, not in the muscle meat, which is all we eat. It's concentrated in the liver and the organ meats. So if you're not eating organ meats, you're not getting the full benefit of a meat-based diet. So you eat plants. But actually plants, the minerals, the most important thing, are a little less bioavailable in that plant carbohydrate structure. Much more available in liver to get your minerals. Okay, that's why I'm drinking my dirty water, because I haven't eaten a lot of organ meat recently, but I have some heart thawing out right now, and I'll be eating some liver. If I make pate, it's a lot better. But the point is, the liver is where we concentrate the micronutrients to the largest extent. So when you want to know the difference between fish oil and cod liver oil, it's just like the difference between muscle meat, plenty of protein, plenty of amino acids when you break it down, but not that many of the other important micronutrients, whereas the liver will have that. Same with the fish oil. Fish oil, plenty of EPA, DHA, fish oils, but it doesn't have the concentration of the important micronutrients, the fat-soluble nutrients, vitamin A, vitamin D, vitamin K, vitamin E. That's where you get your antioxidants, from cod liver oil and from vegetables. Very important to take your cod liver oil. So there you have it there. So what's the difference between cod liver oil and fish oil? They call them two different supplements. But look, fish oil and cod liver oil, the same base, EPA, DHA, fat-soluble, fatty acids, saturated fats, cholesterol, very important for your health. Okay. but then the cod liver oil will have the fat-soluble nutrients. And so if you don't eat 2 to 3 servings of non-fried fish per week, you may benefit from taking fish oil or cod liver oil supplements. I mean, I eat fish every day. But, and then the plant-based omega-3 fatty acids have to be converted to the EPA, ISC, and DHA, ISC fatty acids. A little girl in line with a good mom taking their cod liver oil. And look at this one in the backdrop there. It's like, oh gosh, I have to take my cod liver oil. Diane Sawyer. She's the one that grimaced with Dr. Oz when she took the cod liver oil. And so the next one is simply, Drug Bank talking about what cod liver oil is, what's the difference between cod liver oil and fish oil. They're both very high in omega-3 fatty acids, but the cod liver oil has the vitamin A and vitamin B. And both of the vitamin A and vitamin D are mixtures. So when you take D3 supplement, you're taking D3. But cod liver oil has sort of the same thing that you produce on the skin when you're exposed to sun in terms of D, D2, D3, D4, D5, these isomers. So what I recommend is don't stop taking your D3, because cod liver oil doesn't have that much vitamin D in it. But there's no question that the other isomers of vitamin D have to support it. Otherwise, your skin wouldn't produce it. There hasn't been a lot of good research on these isomers, but I believe if you're producing it, you should be getting it dietarily as well. And cod liver oil is the best form. And then once again, the alpha-linolenic acid from plant-based omega-3s do not convert extraordinarily well to the EPA and DHA type 22 and 20 carbon chain omega-3 fatty acids that are very important to the retina and the brain. And in fact, when you look at the retina, the actual name for vitamin A are retinoic acid esters, retinoic. So there's the link between the retina and cod liver oil and vitamin A. These omega-3 fatty acids and the vitamin A, the retinoic acids, are very critical to eye health, and the eye is an outcropping of the brain. So very, very important. So this slide that I'll put up, and it's just sort of a generic, lowers triglycerides, lowers blood pressure, slight increase in HDL. But what you might see is an increase in LDL. And all your doctors will say, oh, going to put you on a statin drug, your LDL is up. But all LDL is a transport vessel for fats. You take cod liver oil at a therapeutic dose, which we'll talk about. And yeah, you need to have LDL to transport it. So your LDL is going to go up. When you lose weight, Dr. Carter and I have this on our cholesterol and statin drug lectures. This nincompoop from Johns Hopkins says, sure, if you lose weight, I can see your LDL go up because, you might be eating a cheeseburger or something. It's like, he's an idiot. When you lose weight, you're converting fatty acids in storage to triglycerides, and triglycerides are transported, guess what, in LDL. So when you lose weight, you're going to have your LDL go up because you need to move that LDL, that triglycerides around to burn them. They don't just vaporize. They get metabolized. Okay? So here's a very important story about vitamin A, which helps differentiate cod liver oil from normal fish oil. So this is the story of Alfred Summers, Dean Emeritus, School of Public Health, ophthalmologist, saving lives of millions of children around the world who are dying of infectious disease and going blind. And at the end of the day, in Indonesia, even mild vitamin A deficiency dramatically increases childhood mortality rates. Before modern hygiene practices and control of infectious disease through hygiene, 0 to 6 mortality was 50%. And in third world countries, it's still extremely high. Vitamin A curtails that. These are infectious processes. Vitamin A is antibiotic naturally, very important. Okay, so Alfred Summers. And here's Dr. Summers here. And I love this headline, 2-cent remedy. 2 cents of vitamin A is saving lives in third world countries. And and preventing blindness in children. Okay, so that's how profound vitamin A is. But it also tells you a message. I don't want you to go out and start drinking bottles of cod liver oil, because you will potentially experience vitamin A toxicity. There's good and bad with everything. Potassium, extremely important nutrient, runs our electrical system. But too much potassium, particularly if you have kidney issues, can build up and stop your heart. But you need potassium. You need vitamin A. So what I do is, like the reason why Dr. Tremp would prescribe Carlson's, even though it may not be the fanciest brand out there, is it relativistically has the lowest amount of vitamin A. You may be saying, Dr. Lewis, why you want us to go low in vitamin A? No, I want you to go high in cod liver oil for all the other constituents without reaching vitamin A toxicity. So, you can look at the label. Nordic Naturals has a little more vitamin A. Some of the other ones might have a little more vitamin A. So, but Carlson's is the one I generally use. I do not take Carlson's every day or cod liver oil every day because I eat so much fish. But when I first realized how important it was from a health benefit perspective, and I had vascular issues from Lyme disease, I was taking cod liver oil every day, at least a tablespoon, sometimes more. And I was taking Carlson's because of its relativistically low level of vitamin A. And Dr. Carter, if you want to chime in, can talk about vitamin A toxicity briefly. You want to mention that, Michael?
Basically, you don't want to go over 10,000 international units a day in general. Also, especially, for women, if they are pregnant or contemplating being pregnant, no more than 5,000 IUs of vitamin A a day. Because it can cause birth defects, but just in general, as a fat-soluble vitamin, it can cause some liver dysfunction over a prolonged period of time. It does take a little while, but still, you don't want prolonged high levels for that.
You can measure sort of the omega-3 fatty acid levels by looking at the omega-3 fatty acid complexation with a red blood cell. And that kind of tells you if you're in insufficiency. But what Dr. Tremp, my mentor at Harvard, used to do is he would have someone go on daily tablespoon of cod liver oil for about 3 months, then titrate down a little bit, depending on their condition. If their condition was more profound, then he'd probably keep them up there. But, in 2 to 3 months, you probably become saturated at your red blood cell level with the important fatty acids, the omega-3 fatty acids. Then you can start going down to a teaspoon. And, most of the, I recommend the liquid because, a tablespoon is 15 capsules. Who wants to take that? You just take a shot glass and shoot it, half a shot glass, that's 15 grams. But then you can start backing off a little bit with time. And that's why right now I'm doing cod liver oil 2 to 3 times a week, because I'm fully, omega-3 is, fully replete with, complete rather with omega-3 fatty acids. This is what mortality looks like. It titrates really well with the influenza mortality curve. And so, at birth, 0 to 6, we see high mortality. Cod liver oil will bring that down. And as you age, we start seeing this slippery slope. What cod liver oil will do for you is help flatten this curve out and steepen this end game. And we don't know what just attacked my computer. Probably one of Logan's cats. But that was my credit card that just went flipping behind my desk. So anyway, thank you, Logan. So medicinal is born. When someone tells you, don't take cod liver oil, say, what other medicinal has a 1,000-year history of curing serious diseases? And here, the Vikings used to rub cod liver oil on their sore joints and take it internally. Yes, we worry about toxicity. Yes, you can measure toxins and work with Dr. Carter on deeper dives and improve your detoxification pathways. But you need to support brain health. And these fatty acid oils, extremely important to brain health. Vitamin D, vitamin A. So a woman who labored under the most excruciating rheumatism and was an outpatient of the infirmary being advised to rub her joints with the oil and was induced to take it at the same time internally. A few weeks restored her to the use of her limbs, and she was cured. This is 1700s. Dr. Carter, have we not done that in individuals? This exact, getting people to overcome their rheumatoid arthritis with.
Oh, absolutely.
Yeah.
Absolutely.
So, so this goes back. Now we're talking 350 years of documented proof that this works. So, a lot of people are on pain medications. The right dose of cod liver oil can effectively reduce pain and reduce the need for anti-inflammatory drugs. More on rheumatoid arthritis. Several positive outcome clinical trials in RA present good evidence of the beneficial role of omega-3 intake. So these are clinical trials, not just anecdotal things from Framingham study or, from the Viking era, anecdotal stuff, more formalized things. And clinical trials are hard to get on medicinals because there's no financial interest in them. So setting up a real clinical trial, very expensive. Who's doing that? I don't have his name in here, but probably the number one guy in the world of fish oils in the federal government, and why I don't have him in here, is Dr. Joseph Hibbelin. So let's just do a quick search on good old Dr. Joseph Hibbelin, one of the most distinguished gentlemen I've ever had the pleasure of talking to. And, he's a captain in the military, and he's the acting chief of really the, not really showing it here, but Nutritional Sciences part of the military. And his great talk is on the Institute for Human and Machine Cognition. I believe I have it right. So great lecture, and I'll put it up. Great lecture by Dr. Hibbelin on nutritional armor for the brain. And he does a bang-up job looking at the historic growth of the human brain and how it relates to these marine fatty acids helping the humans develop a brain that is significantly, on a per mass basis, much larger than any other animal. So we have Zoom really slowing me down here, but this is a great talk. So Joseph Hibbelin, Institute for Human and Machine Cognition. So I'll just let a minute or two of this play, just so you see it's not us. It's the feds talking about this too when they get their stuff together with a distinguished gentleman like Dr. Captain Joseph Hibbelin.
Well, thank you so much for welcoming me here. It's a delight and a pleasure to especially leave Washington, and it's 8 and 10 inches of snow, and we have snow of many types in Washington, physical and political, and it's nice to escape it every now and then. I'm Joe Hibbelin, and I'm going to speak on nutritional armor and its effects for brain and behavior. And I'm going to try and make this a combination of a scientific lecture and a public lecture.
So nutritional armor, if I can summarize it in 2 words, fish oil. That's what he talks about. The entire lecture is showing you the profundity of fish oil on brain health and development across the spectrum. Okay, so a great lecture indeed. So here's an old one, lowering serum cholesterol. This helps us really understand mechanism. Cod liver oil is an anti-infective. So what it's telling you really is that your cholesterol is elevated in infectious processes, inflammatory and infectious processes. So you take an anti-infective like cod liver oil, and now other pathways that are helping you combat infection can relax a little bit, aka your total cholesterol, which once again, no one knows what that cholesterol is, but we call it total cholesterol, comes down. It's that simple. Use of cod liver oil during the fall and winter is a tradition in the Nordic countries to avoid colds, flu, things like that because of the vitamin D in it. And most likely, we give vitamin D a lot of credit. But I think vitamin A and vitamin D in combination are a beautiful 1-2 punch therapeutically for infectious and inflammatory processes. Cod liver oil consumption assessed using repeated measures associated with lower risk of coronary heart disease mortality in the general public. Just some more research. Here's really an important one. Treating tuberculosis with cod liver oil. An 1848 British study.
You can try it. I took it out this afternoon. He'll come throw it away.
And I have no idea who's talking. When I'm on the screen share mode, I can't do anything about the muting. So folks have to mute themselves. Wait a minute, I did pull it up. Hold on a second. Let's try to mute. And we do our best not to mute Dr. Carter like I always seem to do, but we're good for now. So anyway, consumption is what this disease is. Spitting blood tuberculosis. So this is like late stage tuberculosis. Tuberculosis is actually making a comeback to some degree quietly in America because of our general poor health. But, tuberculosis is hard to treat today when you're coughing up blood. So what they showed was basically went from 19 to, a 14% reduction out of 19%. So it's really a 200% reduction in mortality taking cod liver oil in a very, very serious disease. So once again, we're seeing some anti-infective or some significant anti-infective behavior from cod liver oil. I will find the perpetrator. There we go. And so just sort of a rundown of the use of cod liver oil medicinally to treat infectious disease. 1833, 1841, 1849. Outcome, 18% disease arrested, 63% improved. And where did we go on that one? Come back, please. 19% unchanged. I always like the unchanged part because no one really knows where they are in the continuum. So obviously some of these people are much more down the path of dying from tuberculosis. And so, I would suggest that that's what we're seeing as a difference. But, cod liver oil is a medicinal with multiple important micronutrients. But that's not the entire picture. You can't eat McDonald's and take cod liver oil and expect to be healthy. I mean, it's not going to be that kind of potency. We have to use it as an augmentation for good health practices in the first place anyway. So in 1855, attributed 19% fall in death due to the use of cod liver oil for tuberculosis. It's a significant number. Keep in mind that statin drugs report a 24% reduction in cardiovascular deaths. They're both kind of relative statistics, but so you're looking at something that's equivalent to one of the so-called top pharmaceuticals we have today in terms of providing some real therapeutic benefit. The American Diabetes Association, a lot of these organizations are not, they tell the truth if you go deep into their website and know what you're looking for, but for the most part, they're promoting the drug industry. They're promoted by pharmaceutical industries. That's what keeps their payroll running very robustly. But even the American Diabetes Association indicates that the progression of type 1 diabetes can be a viral infection. Okay? And I have people that have become type 1 diabetics at the age of 80. I have a gentleman I'm working with in a corporate program that was becoming a type 1 diabetic at the age of 43. Another lady becoming type 1 diabetic in her 50s. If it's genetic, why is it happening at 50? Down syndrome, you're born with it. Sickle cell anemia. So there's something else going on behind the scenes. The average age for onset of type 1 diabetes is 12 to 14 years old. They're not born with the condition. So there's something more than a genetic component. And, they test the hypothesis of whether cod liver oil or vitamin D supplementation by the mother during pregnancy could lower the incidence of type 1 diabetes. And in fact, the result of that study is it could. The problem with a study like that is they're not looking for the particular viruses and seeing what their levels are and seeing what it is before and after treatment. That's really what you need to do to understand these processes. But it just shows you that there can be an infectious component, and indeed cod liver oil has some efficacy against virals as well as bacterial agents. Here's proof of that, because I believe most cancers are infectious and viral infections are probably the predominant type of infection that drives tumorigenesis, okay? So cod liver oil, other dietary supplements, and survival among cancer patients with solid tumors. Interesting. All solid tumors. So whole year daily use of cod liver oil was associated with lower risk of death in patients with solid tumors. Every one. Okay? Same mechanism. And in lung cancer patients. Now the risk ratio here is 0.77. That means a 23% reduction in mortality. That's significant. That's very significant. And in lung cancer patients, the 0.56 means 44% reduction in lung cancer mortality. And all they're doing is taking this disgusting fluid every night, teaspoon, whatever, not super high dose, but you titrate up with a good dose and then you can back off. Cognitive aging, childhood intelligence, and the use of food supplements. Dr. Tremp's grandson, who when I talked to Dr. Tremp's daughter, his grandson was taking cod liver oil when he was like 7 or 8 months old. Got a full boat academic and athletic scholarship to, I think, Walter State Community College. Oh, wait a minute, no, MIT. Okay? Cod liver oil, cognitive function. We got to get our kids. And the crime is that a lot of OBGYN for pregnant women, preparing them for a C-section, which is surgery, tell them not to take fish oil because of concern about excess bleeding, which has been shown to be relatively a red herring. Maybe there is some excess, but you can control bleeding. Controllable, vitamin K, things of that nature. But they're affecting brain development. Look, the brain develops in utero, okay? Cod liver oil by mom will help with gestational diabetes and brain development in the child. So it's extremely important. And if your daughter or you or your granddaughter is pregnant and their doctor says don't take fish oil, find another OBGYN because they're setting you up for a C-section. Yeah, something can go wrong and there may be, some procedure, but they're really setting you up for a C-section. And you don't want that doctor, period, in my humble opinion. Effective supplementing pregnant and lactating mothers with N3, omega-3, very long-chain fatty acid on children's IQ and body mass index at 7 years of age. This study suggests that maternal concentrations of N3, very long-chain polyunsaturated fatty acids, cod liver oil during pregnancy might be of importance for later cognitive function such as sequential processing. There's no question about it. My daughter was running intake at a arts college in Massachusetts, and she said 75% of the kids are on mood controlling drugs. Their brains are inflamed. They're not eating fish at all. They're eating a lot of fried food. They're eating junk food. They're not getting these omega-3 fatty acids critical to developing the circuitry in the young brain and the developing brain and in the older brain. I was David Harshfield. Got me invited to Boston BioLife Regenerative Medicine Conference in San Diego, which I just got back to. So I'm sitting on Monday after the conference with all the pundits, and I'm talking about cod liver oil, and they all look at me. These are the leadership team. They said, should we be taking cod liver oil? It's like, you never heard of this stuff, huh? Regenerative medicine? If you want your exosomes, stem cells, and other procedures to work, you better doggone well have an anti-inflammatory and anti-infective milieu prehabbed in your patients. And then you'll start seeing even better results. Now, David, can you remind me of Michaela and the people that are working with that volunteer organization on soldiers and traumatic brain injury? Can you pipe up for a second, David? Are you there?
Sure. The Veterans in Pain, VIP, is a group that is having to work in a parallel fashion with the Veterans Administration. And when I was the chairman of radiology for Little Rock VA, which is the largest VA, we were starting to try to do stem cell injections for knee pain and so forth, and they were still doing knee replacements on 50-year-old special forces guys. And that's kind of when I left the VA, because they didn't get it. And this group now is working in parallel to a 501c3, and they're allowing veterans to come out of the VA system and be treated by us and with regenerative therapies. And I talked to Michaela, who's the CEO of the VIP group, who Thomas, I'm sure you know.
Oh, yeah.
He said, we can't do the stem cell injections. This stuff does not work on its own. The patient has got to have endocrine system balance, all the laboratory, that they need cobalt, they need things no one's ever heard of. And when they do that, half of those folks, Dr. Lewis, don't need a stem cell injection of their knee pain cell. So it's a very powerful group, and I think that we're seeing this in the NFL, we're seeing NASA, we're seeing a lot of government agencies like the VA that have just been given a binary answer for every problem. What drug, what surgery? We're trying to say, hey, you can always do that. Try this first.
Right. So, what I'm presenting here, I was hoping Michaela would be on, but I'm not sure she is, but I'll send it to her, is I've added this since Monday, but I've known about this for 10 years or so, even longer. They're anecdotal, but here's a remarkable recovery. 16-year-old struck by a hit-and-run driver. Doctor advised his family to let him go. Nearly brain dead. And what they did with this child is very high-dose fish oil therapy. And this kid essentially 100% recovered. Okay, it's an N of 1, but it's the power of anti-inflammation at the right dose, implemented hopefully sooner than later, but maintained as a dose to downregulate inflammation. And this is not the only one. There are several other instances of this, and then here's just a trial in a peer-reviewed paper in the National Library of Medicine. Repetitive and prolonged omega-3 fatty acid treatment after traumatic brain injury enhances long-term tissue restoration and cognitive recovery. My issue is how we get these children to take high doses. And I'm particularly talking about autism and intermittent explosive disorder and mood disorders. When a kid's in a vegetable state, you can give it IV or whatever, some sublingual, however they were doing it. You can get high doses, but a lot of kids, it's like, no, I'm not interested. And that's a shame, because it really is a treatment if we can get high enough dose into their system. So these results indicate that repetitive and prolonged omega-3 PUFAs, polyunsaturated fatty acids, cod liver oil, after traumatic brain injury are capable of enhancing brain remodeling and could be developed as a potential therapy to treat TBI victims in the clinic. Could be. That's what researchers always say. But I bandied about creating a brain rescue supplement for kids involved in contact sports. Because the best time to treat a brain injury is within the first 30 minutes of the brain injury. And Dr. Harshfield, guess what a better time to treat a brain injury is?
Don't let them play football.
Well, okay, that's a better answer than me.
Give them a golf club.
But how about 30 minutes?
Before.
30 minutes before. Thank you. POTUS wins again. POTUS wins again. But seriously, take some fish oil before. Get your anti-inflammatory environment up. But stroke victims that take an anti-inflammatory within 2 hours of the stroke do much better than, get them to the hospital, put them on blood thinners, all that. Put them on an anti-inflammatory. That's what saves the brain. It's the inflammatory process that's really bad. So, if my kid was in contact sport, or maybe I should be looking in the mirror because I still play hockey, I should be taking my fish oil before the game and have some fish oil with me. It will, what is it? What is the old cliche? An ounce of prevention is worth a pound of cure. So POTUS wins. POTUS wins again. So let me pop my glasses. Always win. Sensible young lady. So we managed to have a blank slide here, so we'll skip. Quality, people worry about quality. And Mercola and I talked about this back in, a year ago, July, when I was interviewed by him the first time. And he says, I don't recommend cod liver oil because it's processed. Well, there ain't one supplement you sell, Joe, that ain't processed. It doesn't look like a pepper to me or a squash. They're all processed a little bit. Yes, there's some processing to cod liver oil, no question about it. They reinfuse the fat-soluble nutrients into it, But still, you're getting those fat-soluble nutrients. It's a reinfusion. It's not a synthetic thing they're putting back in. So anyway, Kresser is a really good scientist in healthcare. He's out in California. And he says he's received several questions about the safety of cod liver oil. Vitamin A will have toxicity. Everything has toxicity profiles if you have too much or too little. But they recommend an extra virgin cod liver oil. Generally, the real Norwegian cod liver oils that are fresh, raw, handcrafted from wild livers using very rare ancient extraction techniques. And the ones, the big commercial ones, a lot of people are using these things in functional medicine and beyond. So I have food. I'll get it later. I'm good. I'm probably eating at 10 o'clock tonight. Thank you, Logan. My son taking care of me. But I don't think processing is that big of an issue. And the reason why I don't is because Dr. Tremp could see disease processes in the eye, looking at the retina, looking at the nervous tissue, looking at the vascular tissue, having people taking cod liver oil, seeing stabilization of vascular disease, seeing improvement in neurological conditions. So there's no question there's a anecdotal large cohort in his practice of cod liver oil, mainly the thing he was recommending people do. He wasn't a functional doctor. He was seeing people within the constructs of a traditional ophthalmic practice, sending them away with an occasional eye drop, but cod liver oil, and seeing improvement in their eyes. Okay, so here's just a little thing on the preparation. I won't go into that in the big deal. And then, most of these things are distilled to get rid of the PCBs and other toxins and purified. So a little summary: high in vitamin A and D. I was working in a corporation with Dr. Carter. We had a parallel weight loss program we didn't run. And I had many participants say, I'm not going to take cod liver oil, too many calories. I'm on a calorie counting program. And the ones that didn't take cod liver oil that were pretty sick at the beginning of the program, even though they were in our program, were sicker at the end of it because we couldn't get them to make dietary changes and add important anti-inflammatories like cod liver oil to their system. They were paying more attention to the weight loss. And if they stuck with what we were doing, they would have lost the weight and improved their health. But, what do you do? Calorie counting. Don't calorie count. It's not about calorie. Count nutrients. And make sure your nutrient counting goes above your ability to count, because that's what you need for nutrients every day. But anyway, here's a breakdown of cod liver oil. So 1 teaspoon has 90% of the RDI recommended daily intake for vitamin A, and those are usually low. So you're safe at probably, 15 mil, which is a tablespoon, 20 mil, things of that nature. And there will be differences. May reduce inflammation. They're being very conservative. Will reduce inflammation. May improve bone health. We all know that vitamin D will improve bone health. The number one thing that improves bone health is stressing your bones. No bone is going to grow if you're sending a message to your brain that you don't need it. So the way you need it is by doing weight-bearing type activities. And then, of course, cod liver oil, magnesium, selenium, the host of trace minerals, very important for that. RA, we talked about that. RA is an infectious process, an infectious inflammatory process. So many times RA is titrated to root canals or other indications of poor periodontal health below the gum line. Eye health, retinoic acid, the retina, pretty obvious. Heart disease, inflammatory process. Your cholesterol comes down with cod liver oil, so you reduce inflammatory processes that affect the heart. Very important. Brain health. You don't want frayed wires in your brain. And omega-3 makes good quality copper wires. Maybe even you could call them platinum wires. Wiring your brain with the omega-3 fatty acids. Very important. We have a testimonial from a lady who's taking cod liver oil. She feels she averted a stroke, and had some of her gut symptoms clean up. And she's a master's level physical therapy lady. So there's no question that some of the things like H. pylori, SIBO, some of these things are infectious. Cod liver oil, vitamin A will help with that. Forget Diane Sawyer. Easy to add to your diet. Okay, I should play that clip from Diane Sawyer and Dr. Oz. But then here's our book, Eat Fat, Lose Fat. And the most important superfood is cod liver oil, taken right from Eat Fat, Lose Fat, Weston A. Price Foundation. And they go on to explain it, of how important it is. And then we end the show with, okay, they're still a little concerned about taking their cod liver oil. But good mom, good teacher, I don't know who this is, but I like what she's doing. Anyway, with that, let's see what kinds of questions we have on cod liver oil. Hey, we did pretty good. We didn't have that many comments on the back noise. That's an improvement. Oh, one. Yeah, okay, maybe I didn't read fast enough. My experience treating myself is to keep gently pushing things back towards the balanced midpoint. If you drift to the left, come back to the center. Drift to the right, come back to the center. Michelle, you want to explain that? I'm not getting the context of it. And then she says, I feel for you, Andrew, because Andrew's taking the doggy version of cod liver oil.
Yeah, let me see if I can put myself on video. I don't know what's going to show up.
We see you great. You're right there. You're right there.
Am I here? Okay, I don't look so good, but okay. So what I was saying had something to do with what you were saying about dosing and about not taking too much and not taking the same stuff all the time. So I am very intuitive, and I try to tune into my body and take what my body needs, and sort of, I feel like I'm balancing myself all the time instead of following usual doctor guidelines and taking the same amount every single day, all the time, continuously.
Mm-hmm. So,
and I don't remember what you said at that moment.
Well, no, we talked about upping the dose initially, then titrating down, switching brands.
That wasn't it, though. It was something about, okay, so I don't know if this, I don't remember what you were talking about, why I put that in, but one of the things that concerned me was I went and I got my vitamin A supplement, which is 25,000 IUs. But it's made out of different types of things, so it may not be as dangerous because they do recommend for non-pregnant people 1 a day. So I don't take 1 a day of this. I do take this. I take it with my vitamin D and my vitamin K. I also take cod liver oil, but not as often as I should be, so I'll get back to that. I take parent essential oils, if you know what parent essential oils are. You know what that is?
Not necessarily, but
Videos. Yeah.
Essential oils.
Yeah.
What's that?
They're plant-based. Plant-based.
No, it's something different. It's like the all right. I shouldn't explain this now because I haven't thought about it, so I'm not going to get the oil names correct. But they're
GLA
like
and CLA.
precursors. It's the precursors to DHA and what's the other one?
Yes, GLA and CLA.
Okay, so when you take them at very low doses, relatively low doses, apparently your body is able to manufacture what it needs from them. So you don't have to take high doses of the EPA and the DHA. So this has nothing to do with everything else that you were talking about cod liver oil and the other nutrients and minerals. This is just the essential fat part of it.
But Michelle, not everybody has the ability to convert those well. So a lot, you see a lot of brain issues and eye issues and McCulley wrote about, elevation in homocysteine in people that just get things from plant-based sources. So I'm really big on getting the marine-based oils, but I'm not against, but what I recommend people to do that want to stay vegan is go to the root, and the root is algae. So you can get algae oils that are much more, you're going to get, I think it's DHA in the algae-based oils. So that's a good source. But converting the linoleic acid is not that efficient. And I think the brain needs more than you think. It doesn't necessarily have feedback mechanisms to tell you what it needs all the time. I like the fact that you're somewhat in tune to nature. Animals can tell the weather much more than humans can. They're much more in tune with themselves. But, I'm really super bullish on directly marine-based fatty acids. And then, like in your eye, you have an enzyme called elongase. It's going to take the 20 and 22 carbon chain omega-3 fatty acids and promote it up even longer. And, everything about aging is about losing flexibility and mobility and pliability. And these omega-3 fatty acids impart a lot of flexibility into tissue. So it's very critical to have a supply with them, especially when you're past 45, 50 years of age. So I think what you need when you're 20 and 10 and what you're making versus when you kind of hit that age of no longer being reproductively viable can be very, very different.
I understand.
There's a really good book called The PEO Solution that really goes into extreme detail on the parent essential oils. So it presents both sides, but it's very, very compelling. Like you were saying, a number of people really feel the PEOs are a much better backbone. So Dr. Rowan was also one of the commentators in that book. So it's a very good book.
What's the name of the book?
The PEO Solution. The Parent Essential Oil Solution.
So I look forward, I haven't begun working with you guys yet, but I will be. So I look forward to having you help me customize something for me. So I appreciate that.
You sound like a Dr. Carter person.
I may be.
No, I'm just saying because his breadth and depth of knowledge is just much greater in the kinds of areas that you're already asking questions in,
For example, you mentioned earlier detoxification. So I already had indication that I'm not detoxifying properly. So that's the kind of thing I definitely want to be working on. Mm-hmm. I've also had several traumatic brain injuries, so I want to be working on my brain.
Yeah, no question, but yeah, good. We're happy to do that. But, one of the things that we do that, say, the Bredesen Protocol and a lot of other folks aren't doing is look at your vulnerabilities and how it leads to an uptick in infectious things. Like today I had 2 people with elevated Toxoplasma gondii. I had the Mecklenburg Department of Health calling me because I'm obviously showing that there's a Lyme pandemic going on. there's not a Lyme pandemic going on, just too few people are testing for it. I had the health department call me up from Tennessee, because that's where I'm located. So I did testing on people in Indiana that had Rocky Mountain spotted fever. And so the Tennessee Department of Health is calling me because now there's suddenly a Rocky Mountain spotted fever outbreak in Tennessee. It's like, no, a family that spent a lot of time in Colorado and all over the world, they all have a little Rocky Mountain spotted fever. They know it, and I've been testing for it for several years. So it's like one family. And they're in Indiana. But the thing is with these infectious diseases, there's so few people test for them properly. And they can come in the back door when you're most vulnerable. And so taking cod liver oil is just one of the things that helps you, really at the end of the day, these are the things that bring you down, particularly the brain.
Well, I just want to add one thing, which is that I appreciate that you made comments that contrast with so much that we're hearing from people like Dr. McCullough or otherwise in the news, putting cod liver oil down or fish oils down for a variety of reasons. So it's interesting that you have a different point of view on that.
My mentor knew what the heck he was doing. And more importantly, as a clinician seeing people every day, he measured people. Okay? And that always trumps, and his name was Tremp, these clinical trials on selection bias populations with dosing that's not designed by a clinician that knows what the heck they're doing. So I always when I work with people, I learn a lot more than I do from combing the literature, because it's real.
One thing, if you're taking 25,000 IUs a day, you definitely need a micronutrient test. And that would be the only test that would adequately assess that.
Are you there? My Zoom disappeared.
And my Zoom just went weird too.
Yeah, I don't see you anymore.
That's a blessing, maybe, but but no, we're still here.
No, the point I was making is that I'm not taking 25,000 IUs a day. Is that I throw it in occasionally. But now that I hear from you, I throw it in when I feel like I've eaten something or something's gone off in my body that I need the vitamin A. But anyway, I want to talk to you later about that. But also, I will say that my vision is excellent and getting better and better as I'm getting older.
Yeah, my IQ.
I have superb near vision. It's perfect. And my nearsightedness is reducing. So it's like my vision's getting better and that's getting more near perfect vision.
My IQ went up when I started taking cod liver oil, but my baseline was pretty low, so who really cared? But, Michael, that was
I beat me to the joke.
No, but the thing is, if anybody's worried about vitamin A toxicity, you go to WebMD and Mayo Clinic and look at the kinds of manifestations that come, and just be aware of what it can look like. But I can promise you, most of you are not going to be reaching that kind of threshold. If you looked at the British study on tuberculosis, they were doing up to 50 grams a day. And were they worried about vitamin A toxicity? No, they're worrying about people living. Okay. So it's a little bit different, but there's good precedence for those kinds of high doses longer term. That's why my threshold is kind of some people will take 2 tablespoons for a short amount of time to up titrate their omega-3 fatty acids and the vitamin A, but then we back them down. Are you worried about microplastics in fish and fish oils? How does our digestive system handle that? We take all kinds of stuff in that our digestive system knows how to deal with. But I think good quality brands are distilling these things, and you're probably not going to get those carrying forward. Barbara Walters, no, it was, now I remember, but I already forgot her name already. Boy, like I said about the IQ there. Who was the lady? Diane Sawyer. Thank you so much. It's been a long day, and I red-eyed last night. So what do you think about green pastures with the butter oil? I think a lot about it, and I don't necessarily would take it all the time, but I think there's a lot of, you get a black mark against you, and then it lasts forever without justification. So I don't know if fermented cod liver oil is better. Michael, any comment on that?
I'll take it as well. I think it's good, with the X factor. I mean, basically, the butter oil has the vitamin K2 in it.
Yeah, and you want to take, the high vitamin butter. which is derived from the early grass sprigs in the spring. That's that's Western price, the high vitamin butter. So like you want to get your butter from a good farm if you can in the spring. And that is you look at the long winter, Laura Ingalls Wilder. They were surviving on a little bit of potato and high vitamin butter there into April the following year in South Dakota when the snow was still, 12 feet deep. So extremely. Yes, it is good to do Augie. Dr. Lewis will explain. Doris, I don't know what you mean. I can't explain what I don't know.
Someone asked about rubbing cod liver oil on the body, and you did explain it.
I've never
Rheumatoid arthritis.
I've never personally experienced that. So the challenge is you have the stratum corneum, which is a block to a lot of substances from passing from the skin, topical skin, into the bloodstream. But maybe there are components in cod liver oil that pass through.
Ready or?
Say it again.
Hey, Doc, can I ask a quick question?
Go ahead.
What were the brands again that you recommended?
So I'll put them up on the chat here if you can read that. But it's, let's see, this is just to, let me go. I have animals invading my environment. So Rosita, Rosita, Carlson's.
Okay.
Nordic Naturals, Green Pastures, and then, yes, Andrew, we'll throw in Garden of Life.
Thank you.
Yep. Let's see if we have any more questions.
Someone did ask if the fermented was better. You just skipped over that one. Jerry was asking if fermented.
Well, Dr. Carter says he takes it. So what I recommend is, has anybody done a head-to-head study on the fermented versus the non-fermented other than the manufacturer? So I'm not afraid of throwing in a little fermented once in a while, but once again, it's probably not my mainstay because my mentor did Carlson's. And I'm not saying that I can prove that Carlson's is better, but I've seen the results and I'm happy with the results, so I'm sticking with that. But I do Nordic Naturals, I do Green Pastures, I do Garden of Life occasionally. Is the CLO more important for the vitamin A or the omega-3 oils? Yes. That's kind of like Yogi Berra. When you come to a fork in the road and it has to do with cod liver oil, take it. How do you balance the possibility of vitamin A depressing vitamin D without taking vitamin D caps? Does vitamin A, inform me, Wayne, I'm not sure that vitamin A is depressing vitamin D. They're both different fat-soluble nutrients as long as you have...
But you want to take all of them, A, D, E, and K.
Absolutely.
Balance it out. Yeah.
Absolutely. Is taking 2 capsules of Go Green Pastures a day a waste of time? Never. Look, we're shoveling against the tide, and anything you can do to reduce the current is a good thing. But I just recommend that, people do more than less fish oil. And if you want to find out if you have enough fish oil in your diet, Dr. Carter can do an omega score. He can do a micronutrient test. He can do the red blood cell omega-3 complexation testing and all that. But most people in America, with a traditional American diet, will never get to enough fish oil. Considering you go out, you even travel out my driveway and go down the street. Soybean oil, soybean fields, corn fields. We're trying to compensate for all the omega-6 intercalated into our food supply. So if your diet is really strict, then you might want to worry about taking too much. But for the most part, it's almost impossible because you're trying to counterbalance all those nasty omega-6 corn and soybean oils. Yes, Judy. You're not going to say something, not ask something. Thank God, my brain is done.
I took your CDT test in January and had pretty good labs. You told me to add cod liver oil. I did. I took them again in August, and now I'm green on everything. Just cod liver oil was the only change I made.
Well, there's some selection bias in this, Judy, because you became a health zealot as well. But I know, so I will never claim, as much as I love that testimony, I will never claim that just taking cod liver oil is the answer. But if you're already...
Oh, no, I did.
I know you didn't. I know you didn't, but I'm just making sure that the ears out there hear it. So it was an important contributor to your health journey.
Well, it was the only change I made during that time. If anything, I loosened up on my diet a little bit, adding some gluten and stuff in social occasions. And it didn't hurt me. So
Bingo. Yeah. And your health journey is, you want to tell a little bit about, how you...
Well, I started the Plant Paradox diet in 2018 when my GFR had gone from the mid-50s to 43. And I found Dr. Gundry said that he considered kidney disease completely reversible through diet. He sees it every day in his clinic. So I got serious about doing the diet. I never did the phase 1 and 2, which is to, get your system suddenly in there. And in the process of a year and a half, I had lost 90 pounds that I needed to lose. That was not my goal. My last GFR was 71.
And plants are they have so many detoxifying substances. I'm not completely in favor of everything Gundry does, but I think from a therapeutic perspective, and your gut's a little bit out of whack, I think it's a very good program. But all we recommend is just, if this is the slice of your plate that's vegetables, make it this. Everybody just increase vegetable intake, and then try to throw a little organ meat in once in a while. I don't care if it's cod liver organ oil, or other organ meat. My favorite organ meat is duck, because it's extraordinarily mild, and the duck meat is of the fattiest of all the land-based, quasi-land-based meat, so I enjoy a good duck now and again. I probably do a duck at least once a month, try to do it more often than that.
Well, I got rid of casein A1, limited animal protein, a lot of veggies, and I eat a lot less, and I'm never, intermittent fasting, restricted time. I eat all my food within an 8-hour window most days.
GFR, Doris, is just a calculation of how efficient your kidneys are at clearing toxins away. And then Michelle, thank you, my dear. You're one of the few that says beef heart is amazing. I think it's the best cut of meat I've ever had. And I get it for free. Last time they gave me 3 or 4 hearts. I have one thawing in my sink right now.
Ooh.
What?
They're pretty good.
Delicious. And because I have the dogs, and because they gave it to me, I don't have to worry about, trimming. I trim a lot just so I get the pure fillets, and, the rest goes to the pups.
Dr. Lewis, would you spell your mentor's name, please? Trempe. Clement
Trempe. Trempe.
Thank you.
Yeah. So
what does beef heart taste like?
Tastes like steak, except it's not that fatty like a ribeye, but it's as tender as a ribeye.
Okay.
It's muscle meat. It's muscle meat. It's not even really, quote, organ meat. A heart is a muscle.
Okay.
Yep. I like what Michelle just wrote. She says beef heart is great when recovering from respiratory infections. Much cleaner, pure muscle. Really true. I mean, I like beef fat if you get a good quality beef, but this is very, it's almost like some of the low-fat, lean cuts of meat you get from the other parts of the cow, which I can't tell you what they are, but it's still very tender, very tender.
And where do you get it from?
Where
should we get it from?
So,
local grass-fed butcher.
Local grass-fed butcher, and I bet you that people who are buying cow are not getting the heart. So they might have some stuff, like last time I went, I got 10 livers and 4 or 5 hearts. They just gave them to me. Pancreas, everything. I asked for the brain, and they showed me 3 cow heads, and they said, you can go in and open that up yourself and take it. And I said, I'm okay. I'm okay. I'm okay. But what food is highest in cholesterol in the animal world is the brain of any animal. So therefore, it's very obvious that God intended to kill our brains by putting so much cholesterol up there. Oops. Or maybe there's another purpose. And on that note, so Michelle says farmer's market, it's a delicacy, and it cost me $0 per pound. So I love it. All right, folks, we'll try to publish these things. A little bit busy these days, and so it's been a little bit of a delay in getting things published. But until next week, thank you so much.